Hi everyone, my name is Dr. Nadeem. I'm the emergency medicine physician at Indra Gandhi Co-operative Hospital. I'm here to give an insight about stroke, or also known as cerebrovascular accident, that happens for a lot of population across India. So, stroke is a major case of mortality and morbidity across the nation, and it's a global emergency. And emergency medicine physicians see stroke as a very serious medical ailment that needs an early intervention, and that can actually save from a lot of mortality and morbidity. So in India, we are almost having 200 stroke per 1 lakh patients, and the number of deaths or mortality or morbidity of the cases are almost 18 to 42%. And the major cause of which is because of the lack of early management or lack of early intervention, which is actually known in the pre-hospital setup with the help of the acronym or the short term which we call ACT FAST. So whenever there is a stroke, you have to act very fast, just like that acronym sounds like. But along with that, it has an inner meaning of which each alphabet has its own meaning. So like I said, stroke is very common across a population, and usually it is seen in geriatric population, and soon after the COVID event and the vaccination, we are seeing stroke even in young patients. So whenever you have someone nearby who's a patient, who's a bystander, who's someone elder to you, and whom you suspect as having a stroke attack, you can assess and analyze whether he's having a stroke with the help of the acronym called FAST. So F stands for facial drooping or facial asymmetry, where you can ask the patient ask the patient to smile, and if he's having drooping in one side of the face, that shows that he's having an early sign of stroke, or facial palsy, which is also known as facial palsy, and that stands for the F. And A stands for arms, where you can ask the patient or the bystander or someone who is nearby, he can ask the patient to lift his both arms, and if he is unable to move one arm compared to lift the one arm compared to the other arm, that shows that he is having a stroke, or that is having a weakness of his one limb, which you can you can see right from that moment itself, that right from that attack itself. And then comes the speech, where you need to ask the patient to quiet talking to you, and during that conversation itself, you'll get to know whether he's having any slurring of speech, or if he's unable to unable to form sentences. That means that he's having a chance of getting getting his speech center getting affected. That's also a part of stroke. And then comes T, that's where you have to act. That's time to call for an emergency medicine support. So whenever you see with these three symptoms, F for facial drooping, A for arm weakness, and S for speech irregularity or dysarthria or slurring of speech, you should actually act fast. In outside countries, we have 911, and in India, we have 108 ambulances. So you can just call them right away and get your emergency aid and save a lot of lives. India needs a lot of pre-hospital care awareness, and we at Indra Gandhi Hospital, we are trying our best to provide the pre-hospital care support and emergency support to all the patients, and we are all equipped to welcome and to treat the patient with the help of our with the help of our new emergency department, or also known as emergency and trauma care at Indra Gandhi Co-operative. Thank you.